Good morning students. Today's class we will see about the documentation. Documentation is very important not only in nursing in all the professions. So whatever we do we should have a strong evidence that is there of documentation. So documentation is a written legal record of all pertinent interaction with the client in assessing, diagnosing, planning, implementing and evaluating. Documentation is a recording of information relevant to assessment, planning, implementation and evaluation. So we have to document whatever the findings of our assessment, what we plan for the patient, what we have done for the patient, and due to with that action what the effect on the patient. That means the evaluation. It is the legal record that is permanent and retrievable for future purpose. For any legal actions, we can retrieve it later what we have done and what we have not done. Record keeping system, either handwritten or computerized and format varies among healthcare agencies. The client record is the compilation of client's health information. The client's clinical record is a brief account of personal and medical history of the client, results of diagnostic test, findings of medical examination, treatment and nursing care, daily progress note and advice on discharge. Each nurse is expected to practice according to the local policies and professional standards. Purpose of documentation. First, it is for communication. Primary purpose of the care is to communicate among healthcare professionals to promote continuity of care among departments throughout 24 hours and during entire hospital stay. For example, if the patient is admitted with a medical problem and he need to be referred to a surgical department, if the documentation is very clear and it is legible, then the surgery doctor have no doubts in any of the things he can after assessing the patient and going through the records he can prescribe the medicines. Record is made by healthcare team members, communicate client needs, progress, individual therapies, conduct consultations, client education and discharge planning. Record is the most current and accurate continuous source of information about patient's healthcare status. Information communicated in the patient's record allow the healthcare providers to know patient thoroughly, facilitating safe, effective, and timely centered decisions. Second is legal documentation. Accurate documentation is one of the best defense of legal claims associated with nursing care. To limit nursing liability, nursing documentation must indicate clearly that patient has received individualized, goal-directed nursing care based on nursing assessment. Record must describe exactly what happened to a patient and follow the agency standard. This is the best achievement we chart immediately after providing care. Even though the nursing care may have been excellent, the court of law, care not documented, care not provided. So, even though if we have done and we have not documented, it is considered as we have not done. Records can be used for initial incident analysis for quality assurance. Common legal issues in nursing practice include protection from avoidable injuries, monitoring and reporting change in client's condition, performing correct interventions, not charting the correct time when the events occur, failing to record verbal orders or failing to have them signed, charting actions in advance to save time, and documenting incorrect data. These are some of the common errors which happen in the nursing practice. Third purpose of the documentation is reimbursement. The documentation clarifies the type of treatment the patient receives and support reimbursement to the care agency like insurance agencies. A medical record audit reviews natural charges used in the patient's care. Private insurance carriers and auditors from agencies review record to determine the reimbursement that patient or healthcare agency receives. Accurate documentation of supplies and equipment used in assisting accurately timely reimbursement. Third purpose of documentation is education. Sorry, not third, fourth. A patient's record contains a variety of information including diagnosis, signs and symptoms of a disease, successful and unsuccessful therapies, diagnostic findings and patient behaviors. One way to learn the nature of illness and the individual patient response to it is to read the patient care record. Not two patients have identical record, but we can identify the pattern of information in records of patients who have similar health problems. The fifth purpose of documentation is quality assurance or auditing and monitoring. An audit is a review of client's record for quality assurance purpose. As a part of quality assurance program, healthcare agencies like JCAHO, that means Joint Commission Accreditation of Health Organization, periodically conduct chart audit to determine whether or not the care provided meets established standards of client care. And the sixth function of documentation, purpose of documentation is research. Information contained in a record can be a valuable source of data for the research. The treatment plans for a member of the clients with the same health problems can yield information helpful to treating other clients. The seventh is the purpose of documentation is planning. Plan for health services and client care. Client record points out health problems of a country and provide baseline for local, state, national and international healthcare service planning. Each healthcare professional utilizes the data from the client record to plan care for the client. Nurses use the baseline and ongoing data to evaluate effectiveness of the nursing care plan. And eighth purpose of documentation is decision analysis. Information from the record review often provides sufficient data for administrators to do strategic planning regarding the needs of the client. Also, it will be given idea regarding the overuse and underused services, financial information about which generate revenue, etc. Next comes the principles of documentation. There are some general guidelines which we have to keep in mind when we start to the recording. Because the client's record is a legal document and may be used to provide evidence in the court, many factors are considered in recording. Healthcare personnel must not only maintain confidentiality but also meet legal standards in the process of recording. First one is date and time. Document the date and time of each recording. This is essential not only for legal reasons but also for the client's safety. Record the time conventional manners, for example, either in the 12-hour manner or in a 24-hour format according to the rules of the hospitals, which avoid confusion about whether the time was AM or PM. Timing. Follow the agency. Agency policy means the hospital policy. For frequency of documenting, they adjust the frequency as the client's condition indicates. As a rule, documenting should be done as soon as possible after assessment or intervention. No recording should be done before you providing the nursing care. To save the time, some may be recorded and they think that they can come and later they can come and write the time, but you should not do that one. Third one is legibility. All entries the client record must clear, easily readable to prevent interpretation errors. Hand printing or easily understood handwriting is usually permissible. Permanence. All entries in the client record made in the dark ink so that record is permanent and changes can be identified. Dark ink reproduces well on microfilm. That means when we take the Xerox copy and in the duplication process. Follow the agency policy. Agency means I earlier told it is a hospital policy about type of pen and ink used in recording. That means some hospitals prefer blue ink for the morning shift, black ink for the evening shift, and night ink means red ink for the night shift. Accepted terminology. Use only commonly accepted abbreviations, symbols and terms that are specified by the agency. Many abbreviations are standard and used universally. Others are used only in some geographic area. When in doubt whether to use an abbreviation, write them full. Then correct spelling. Correct spelling is essential accuracy in recording. If unsure how to spell a word, look it in a dictionary or other resources. Sometimes two different medications may have the same spelling. Then signature. Each recording the nurse's note signed by the nurse who made it. Correct way to sign notation is use first initial and full last name followed by the abbreviations of healthcare workers' position, example RN or registered nurse. Sequence. Documentation events in an order which they occur. For example, record assessment, then nursing intervention, then the client response. Then accuracy. Client name and identifying information should be stamped or written on each page of the clinical record. Before making an entry, check that this is correct chart. Don't identify charts by row numbers only. Check the client's name. Notations on records must be accurate and correct. Avoid using opinions or interpretation instead of actual facts or observation. Avoid using words just large, good, normal, etc. instead of using the specific data while recording. That means 2 cm into 3 cm bruise rather than large bruise. When recording mistake is made, then draw a line through it and write mistaken entry above or next to the original entry and your initials or your name. Do not erase, blot out or use correction ink. If a blank appears in the notion, draw a line through the blank space so that no additional information can be recorded later. Appropriateness. Record only information that pertains to the client's health problems and care. Any other personal information that the client conveys inappropriate to record. Completeness. Not all data that nurse obtained about a client can be recorded. However, the information that can be recorded needs to be complete and helpful to the client and healthcare professional. Record all the assessments, dependent or independent nursing interventions, client problems, client comments, response to interventions and tests, progress towards the goals, communication with other members of the health team. Care that are omitted because of the client conditions or refusal of treatment must also be recorded. Document what was omitted, why it was omitted, and who was notified. Then, consensus or brevity. Recording need to be brief as well as complete to save time in communication. Client's name and the terms referring to the client are omitted. Legal prudence. Accurate, complete documentation should give legal protection to the nurse, the client, and the other healthcare professionals. Admissible in the court as a legal document, the clinical record provides proof of quality of care given to the client. Then confidentiality. All client records are confidential for that required permission of the client to be copied. Information within the chart should be available to the necessary health team members only. Those who are in need of the client information from the records need to be go through the proper channel according to the hospital policy. Thank you for listening.